Thursday, October the 8th, time for our daily briefing. And with the uptick in activity of COVID-19 cases, you always tend to want to ask a true expert, namely a doctor, to get some perspective. Do we need to be worried? Do we not need to be worried? How do we need to react? And that is, of course, as promised yesterday, is what we wanted to do with today's program. So welcome to the Daily Briefing. These are heard in the 1, 5, and 8 p.m. hours on the radio, on KLAM and KCDV both, and posted to youtube.com/Cordova TV. We visit with Dr. Sanders on today's episode. So, Dr. Sanders, we seem to have a bit of a thing happening here. The question is, how much and how big a deal? So starting with the case numbers, what are you seeing the same thing we are on the dashboard? We're now up to 4 active ones?
Yeah, so we have 4 active cases. We do know that some of these cases have been symptomatic, and so with these cases, we do expect to see those numbers increase and identify more cases over the next 2 weeks.
Oh, okay. So we may be on a bit of an uptick for at least a little while. Are these is it with, see, this is always, we always want to be careful with the privacy thing, but do we know if through the contact tracing, if these are related or are they different sources?
It does seem that there is some relation. However, we have not identified a specific spreading event. I think the important thing to remember with these is, one, of course, we want to protect patients' privacy, and I don't think knowing more details about the individual cases provides increased safety to the community. What we really want people to do is be cautious with their behaviors and help us flatten the curve. Okay.
And the reason I ask about that is wondering, because it kind of speaks to how widespread an event we have. If it's all sort of related to one source, or is it sort of more randomly spread around?
So what I think is, a lot of times when we're looking across the country, we identify these events where we'll say, oh, there was this conference, and we see a lot of cases blossom out of the conference, what they call these super spreading events. We've not necessarily identified a super spreading event. We don't think that these are unrelated, though, and that we have a widespread outbreak. We do think that these are somewhat related cases, and that we believe that it is still manageable, and we can get people to quarantine and self-isolate, and we can contain this.
Okay. I noticed, too, that this the alert level, as indicated in the news release that we read yesterday, has jumped from level 2 to level 3. Can you kind of explain what that means in terms of what people see or what's expected?
We aren't intending to change the alert level to make people feel alarmed or make them feel concerned that we're getting ready to close businesses or change how we're operating on a day-to-day level right now. What we really want, the intention with changing the levels and paying attention to the epidemiology here, is so that we know as a community, okay, we are seeing increased cases. We want everybody to be mindful of their hand washing and wearing masks. Okay,
so just sort of increase, it's more of an increase in awareness than, anything that people are necessarily going to see in terms of how things look around town, or, just everybody please be extra careful so it doesn't get any worse.
Exactly. Cordova has taken that individual responsibility in the past when we've had these small outbreaks that have started, and we've been able to extinguish the outbreak. So we want everybody right now to take that individual responsibility and help us contain this and not have a larger spreading event. So one of the big pieces of that to help contain it is that we be cautious with gatherings that include people that are outside of your household. The indoor parties and gatherings with non-household members really increase our risk of transmission of COVID. So if people can hold off on some of the gatherings and wear masks, we believe that these numbers can start decreasing.
As move about town with what limited free time you have in your position, obviously very busy, does it seem like compliance is pretty good?
Absolutely. Out in public, what I see is people are being compliant. They're being respectful of one another. What we don't see is what people are doing in their inviting large groups into their homes and things like that. So we don't always see some of those high-risk behaviors, which I'm not suggesting that we need to start monitoring everybody's behaviors. We just really want people to take a second thought about gathering with non-household members so that we help decrease the spread of COVID right now and help protect our vulnerable population that we have in Cordova.
The last several weeks when the weekly reports have come out from the state, they have emphasized again that it's gatherings between people not of the same household that have been driving a lot of it. You just mentioned that again specifically. Do we think that has been one of the things that has, while people may be doing the hand washing and the mask wearing, that kind of thing, is an area where, in the interest of getting things back to normal, it's just sort of getting easier to forget about that part, I guess?
Well, I think all of us, as this draws on, we are missing that socialization that we had pre-COVID. I know I certainly, and my family certainly misses having that increased socialization. And in the winter and in fall, it is nice to gather with friends and family. So it is a challenge to keep to ourselves and keep to our own households and not be able to do some of that socialization. However, as we see the upticks in cases, we do know that in order to contain the spread, we all need to take a step back and try to take that individual responsibility so that we can support the community and support keeping the community open, keeping our schools open, keeping kids active in activities, and hopefully be able to get back to the increased socialization soon. I know that's very important for people to do to keep our mental health intact, which I want to remind everybody we do have both at Elanca and CCMC. We have mental health services available. If anybody is struggling, please reach out. We're here to help, and we want to make sure that we're supporting the community as best we can.
Okay. And to reiterate something that we talked about last time, if people maybe didn't hear that program, there's been a lot of talk, at the state level about how things have been swinging up. I mean, on Monday, we set a new record statewide with something like 197 cases reported in that period just in a single day. When I asked you about that, you said it wasn't really entirely unexpected because of the changing of the season. Is that still the case?
Well, we kind of anticipated that there would be an uptick of cases in the fall, much like we see other respiratory illnesses and viruses increase in the fall and winter. Part of that is that once you're indoors and in close quarters with people, it's easier to spread infection. So we see that every year with flu, and we're seeing that now with coronavirus.
Okay, so the main message, I guess, then, again, for Cordova is that in addition to the things we hear about a lot, hand washing, mask wearing, social distancing, it's this, we should really try to avoid gathering outside of our household bubbles. Is that really something that needs particular concentration right now?
I think that right now that is something we need to all be considering because we are seeing a significant increase in cases identified here in town. So we want people to be extra cautious with that. That will help us protect the vulnerable in our population. If we have everybody just a little extra cautious with their gathering, mask wearing, hand hygiene, we think we can flatten the curve and get the COVID out of our community just as we did this summer.
All right. Well, I'm I mean, it continues to seem like a good way forward. So anything else you want to leave us with, or have we pretty well covered it?
We're still doing the testing 6 days a week. We don't have testing directly at the airport. One thing that we have noticed is the airport doesn't seem to be a big source of positive cases for us, which is excellent. We're not importing very many new cases throughout the state. So we still have the airport, the testing available for new arrivals. When people come in, they can come to the hospital or go to Olanka. We do anticipate in the next week or two needing to pre-schedule testing. So we will be putting that guidance out of how you can pre-schedule your test before you come to get it. And otherwise, there's no other information. And thanks for giving me the opportunity to chat with you today.
Well, I appreciate your time and attention and devotion to keeping us healthy. Thank you very much, too. Our thanks, as always, to Dr. Sanders, always willing to join us when, things are kind of changing, which they are. We'll emphasize again that she said for folks not to be surprised if the case counts rise as a result of what's happening right now. We may end up seeing some more. And again, trying to minimize the number of contacts you have outside of your household, the best way to go. So we don't see it spread into the schools or, any other kind of larger subset of the community. So hopefully we can continue to do a good job as we have been for the most part. COVID-19.cityofcordova.net is the official website for the city's response. Again, we're up to that yellow level. If you want to see what that means, by the way, they're going from green 2 to the yellow level 3. You can poke that yellow rectangle when you go to the city's dashboard, and it'll give you that information. 424-INFO if you want to call the city's COVID folks to get questions answered. And the 424-WELL line from the Village of EAC with the pre-recorded information. Again, her advice about the mental health is good too. If you find yourself thinking, we're backsliding and that makes me nervous, I need to talk to somebody about that, then take advantage of what CCMC and Olanka have to offer in terms of those services. In terms of our services, we'll continue to bring you these briefings in the 1, 5, and 8 p.m. hours on the radio. Upload them all to youtube.com/Cordova TV. So if you ever miss one or you want to share that information with somebody else, you can give them that address, youtube.com/Cordova TV. Thanks for tuning in. We'll get you back to regular programming now on the Clam and the Eagle.